able to submit. Oops. I don't know if you can hear me. Okay. Hello, everyone. I'm so glad to be here. I love our reentry and all of our people with resources for the community. God knows they need all the resources they can get. So I just want to introduce myself. My name is Happy Dyer. I'm with the CHI program. And what we do is we provide resources for justice-involved individuals. So we've been able to help a lot of individuals. Once an individual is released from incarceration, they qualify to get signed up for ACA health coverage. And that's what we do. All they have to do is call us, and the whole application only takes about 10 minutes. And now, thanks to the American Rescue Plan, anyone whose income is under 150% of the federal poverty level, which is $19,300, which is pretty much everyone when they get released, they qualify for an ACA plan at no cost, a silver ACA plan. And that's what we do. We're able to kind of reduce that health disparity of the underserved population. And the results have been fantastic. And I'm just very thankful to be a part of it. And I'm glad I have my information in the chat. If anyone wants information on how we can help, feel free to reach out to me. I could send you some information, but the results have been fantastic. And it's wonderful to be able to get the people back on their feet, at least in terms of their health. So that's that.
Thank you, Happy. Kayla has shared some information in the chat for everybody as well. Want to make sure you check that out.
Sorry, I'm having to scarf lunch really fast on my way from a class. So I wanted to throw that in the chat really quick.
That's great. We've got it. Does anybody else have an event or activity or something they would like to share?
I'll just throw really quick. I'm with Village Behavioral Health, and we are now accepting 10 to 12-year-olds, whereas before we were only doing 13 to 17. So now we are all the way from 10 to 17-year-olds.
Jillian, this is Jill. We have Children's Advocacy Days coming up March 8th and 9th. It is a hybrid event. I think we have about 200 seats in person, but I think all of those have been already taken through registration, but there is a waiting list, but you can access that virtually. Our theme this year is Currents of Change, Rivers of Opportunity. And I can put the registration link in the chat.
Thank you, Jill. Anybody else have anything to share?
Excuse me, I should do an introduction. My name is Randy Byington, and I work with the ETSU Rural Health students, College of Medicine students at Little Belgood Elementary School. For the last few years, a focus has been mental health issues within that population and within the support system for that population.
Thanks for being here. I'm glad to have you.
Hi, my name is Carol Wyatt. You can't see my video because I'm having problems with it. I am a community health navigator with Strong Starts Ballot Health. It's one of the initiatives, part of the Strong program that we have here. And I specifically partner with moms and or families or grandparents, whoever's raising their kids, ages 3 months up to 5 years before they get into school. And basically what we do is we connect them to needed resources in order to provide a strong foundation for those kids and the families before they get into the school age years. We will take referrals. We normally connect with these moms either through labor and delivery or within a couple of OB offices. We are going to be expanding that in the future, but I also do find needs out there in the community individually, like on Pay It Forward Carter County or anything like that. And I will immediately reach out to those moms to connect with them, to walk beside them during the critical years of age 0 through 5. Thank you.
Thank you. Anybody else have anything to share? We have a couple of things in the chat. Ashton has shared the rescheduled dates for the Recovery Roundtable and Recovery Rally. Jill has shared information about Children's Advocacy Days, and Misty has shared a little bit about what she does. So make sure you check those out. Anybody else have anything they want to share with the group?
I've been trying to unmute myself, I'm sorry, but I wanted to introduce myself and my agency. I'm with Tennessee Services for the Blind and Visually Impaired. And what we do is that we provide equipment and training to people who have low vision. And our services are totally free. So I wanted to educate the community about us. So thank you for letting me be here.
I actually have a mom that is going blind right now in Carter County that I know that TLC's been working with her. Can I get your contact information? I'd love to connect up with you regarding this mom.
Absolutely. I'll put it in the chat here.
Thank you.
We're glad you're here, Karen. Anybody else have anything to share before we move on? Okay, well, we will move into our sharing session. So as most of you know, each month we highlight one of our collaborative members and have them share with the full collaborative what they do, ways that we can partner, support each other, and ways that we can help their organization or their organization may be able to help you. So today we have asked Randall Sidwell from SOCAT to share. So I will turn it over to you, Randall. Thanks for being here.
Hey, thank you so very much. Do I have the ability to go ahead and share PowerPoint?
You should try it now.
All right, thank you. Then I'll just verify that everybody can see the PowerPoint. Department of Mental Health and Substance Abuse System of Care across Tennessee. Thank you very much. Well, first I want to thank everybody for letting me be here. Some of you I've been getting to meet in other counties and other areas so far, and I really appreciate the opportunity again to come in and be with you. Again, my name is Randall Sidwell. I'm a community engagement specialist for System of Care across Tennessee. You may hear the acronym SOCAT quite a bit, and a lot of people use that rather than saying it all the way out. But of course, SOCAT stands for the System of Care across Tennessee. As we get started, I guess what is System of Care? And let's first define that. It's a spectrum of effective community-based services and supports for children and youth with or at risk for mental health or other challenges in their families. It is organized into a coordinated network. It builds meaningful partnerships with families, youth, and addresses their cultural and linguistic needs in order to help the children function better at home, in school, in the community, and throughout life. It is the philosophy by which System of Care across Tennessee serves children, youth, and their families. System of Care across Tennessee, or SOCAT, is Tennessee's System of Care program. But always put things on mute before you start with it, shouldn't we built on 2 decades of System of Care experience. And System of Care has been the state of Tennessee's philosophy for over 2 decades. And this program has been built out of that philosophy to get to where it is today. And it focuses on children, young adults, and their families. And System of Care utilizes the System of Care philosophy, its core values, and its principles while empowering Tennessee families to work together with child-serving agencies, just like a lot of yourselves, as partners to guide their care. And all of us is, very familiar with that phrase, it takes a village. And that's where that is so unique, about these CABs and these collaboratives and the health councils that I've been getting into is, we see the need of our families, and we all realize that, maybe our program can't do everything. We can do a lot, but we just can't. And there's so many gaps, but the family's needs are still there. And, we have an opportunity to be able to partner together and say, okay, my program may lapse here, but my family still has that need. And, that's where, as system of care or RCP program or the other programs that are offered throughout the representatives here today, that's where we can come in together and make sure that we are giving our families a full wraparound service when it comes to support in our community, because we all know that's exactly what they need. The system of care has 4 core values, and I love this. I guess it's what brought me to this position, brought me to working for the Tennessee Department of Mental Health and Substance Abuse to begin with. And those are family-driven, youth-guided, community-based, and culturally and linguistic competent. And for me, that means so much. My wife and I was around foster care. We've had over 40 foster children over the years. And plus we've worked at 2 group homes, one in Missouri and one in Georgia. And working when I was in foster care and we're working with families, a lot of times families are just given a list. And you do this, this, or you're not going to get your kids back, or you're not going to get this. And which were all needful things, but it was the approach. And we want to come in, and we're not saying you have to do this. We want to partner with you. We want to look at those family strengths that every family has, no matter what situation. They do have some strengths. And a lot of times they forget that. They forget that they have natural supports, whether that's their church or a teacher or a football coach or an aunt or an uncle or a grandma or grandpa. And to get them to realize you have natural supports. To get them to realize, hey, you have professional supports. Our communities have so many different resources. A lot of times our families just don't know about or haven't never used, and they think it's going to be too much of a hassle to try to get involved with. We want to make sure that we're breaking down some of those barriers. So we want to be family driven. We want to be youth guided. Community based is huge for us, guys. Our families, I know how it is. Our families don't want to have to go to Bristol. They don't want to have to come to Knoxville if they don't have to. They don't want to have to go to Chattanooga if they don't have to. They want those services close to home because they're going to feel like that people at home understand them better, right? They know our culture. They know how we operate. They know how we think. And it just makes it so much easier for our families to be open for the services that are available if we can get these in community-based. And then cultural and linguistic competency. We got to understand the culture, whether you're talking about Carter County or Pickett County or Fentress County, Tennessee, compared to out west, Lake. And so we got to understand our people and understand their culture. And then if we do that, we'll understand how to approach them and how to understand why they sometimes operate the way they operate. We'll use these 4 core values in every aspect of the work we do with our families. Our parents and our caregivers are in the driver's seat determining the services and plan for their family. Our youth have a voice in the plan of care, and the plan is built on their strengths of the youth and of the family. If we can get the kids to buy in, we're going to get more productivity out of them. We're going to get more engagement out of them. So that's huge for us. Same way with the families. Families are linked to community-based services that are within the community and are easily accessible, and services are tailored to meet the unique needs of the youth and their families by honoring their beliefs and their traditions. We meet families where they are. System of care across Tennessee goals for children, youth, and young adults are to decrease utilization of inpatient care as much as possible, to reduce the number of out-of-home placements, to decrease juvenile justice involvement and child welfare involvement, to improve the community functioning, including improvements in school performance, whether that's in attendance or behavior, to improve and sustain positive mental health, including increases in behavioral and emotional strengths for children, youth, and young adults. Now, these numbers that we're seeing here on this graph, I'm a statistic person, so this type of stuff I eat up, I love. And I know not everybody's wired that way. Our numbers are a little behind right now because of COVID and getting our statistical numbers in effective. Everybody's dealing with that right now. We served more than 330 children and families during 2017 to 2020. From the data collected, 88% of the 330 children did not have emergency room visits for psychiatric reasons. There was no psychiatric hospitalizations for 88% of those children served. 93% of the children served during this time did not have any arrest. 93% of the children did not go into custody. These outcomes are huge because all 330 of these children were identified as being at high risk, the top tier. But yet we look at these numbers and we see how effective this program can be when we come in with a high fidelity wraparound service and partner with all the other providers that we possibly can to make sure the family's getting everything that they need to be successful. System Care across Tennessee provides intensive care coordination services using a high fidelity, you've heard me say that now a few times, high fidelity wraparound approach to care planning that builds on the collective action of a committed group of people, which includes the family, their natural supports, and formal supports. This team of people mobilize resources and skills, which results in the creation of a plan of care that is best fit for the family. Services are in the home. Right now we're all dealing with having to do a lot of virtual stuff. So, normally a System of Care across Tennessee, we want our services to be as much as in home as we possibly can, whether that is our care coordinators coming in, our FSSs, family support specialists, or our therapists. We want to make sure that we're meeting the family there where they need. A lot of our families, they can't drive to Bristol because not necessarily they don't want to, but because they don't have the money. They don't have that gas. They don't have that time to get that far out of Whately County. Same way if we ask them to come to Knoxville or Chattanooga. So realizing that, is part of the System of Care across Tennessee. They got that in mind and say, we need to try to meet these needs in their home counties and as much as possible in their home. There is no charge for this program, and it usually lasts between 9 and 12 months. After 9 or 12 months, though, the family isn't just like kicked to the curb. The family is reevaluated. They're looked at it and see if the program is still needed. And at that point, a decision is made whether to stay into the program or that program be passed on to maybe some other services where the family has stepped down. The System of Care across Tennessee has 2 teams, which provides direct services and supports to our families. They are the care coordinator and the family support specialist, and a care coordinator or a therapist. And that's determined just on the needs for the family, in the children. If a therapist really isn't needing, if it's more FSS things, helping with IEPs or FSSs do, and they help with a lot of juvenile justice things and things like that as well, then that may be the route. If there's mental health issues or strong behavioral issues, then we have that therapist right there as well as part of these teams. The thing is, though, like our care coordinator is really the air traffic control of the whole team. The care coordinator's responsibility is to ensure that all phases and activities of the wraparound process are done to high quality and high fidelity. They connect families to resources in the community and assist the family with identifying natural supports, professional supports to be a part of their family team. The FSS is a person who has parented a child with emotional or behavioral challenges. So they have that lived experience and training to help guide, support, and educate other parents or caregivers with navigating systems such as juvenile justice, mental health, child welfare, and education. For example, I know a grandmother right now that's in her 80s, right? She had never heard the term IEP. So when she got a phone call from the school about IEP, she didn't know what they was talking about. They told her she needed a meeting for an IEP. She didn't know what IEP was. And so it's that type of partnership, the FSS and I know a lot of you guys are working with families are the same way and you're doing the same type of work. But that's where they would come in. They're going to come in and be in the home with that parent and say, okay, let's look at these things. This is what an IEP means. This is what the school is asking for. This isn't a bad thing for your child. This is wanting to help your child. So I set up an individual educational plan so that we can make sure the child doesn't get further and further behind educationally. The therapists provide therapeutic intervention utilizing an evidence-based approach and practice. The team is assigned based on need, eligibility, and location. The eligibility criteria is children, youth, and young adults between the ages of 0 to 21 years old experiencing emotional or behavioral concerns that affect their daily life, such as having trouble in school, with their family, with peers, or adults with law enforcement or children's services, has been or is at risk for psychiatric hospitalization, residential placement, or DCS custody, and is willing and interested in participating. You know, this isn't a program that is shoved on a family. That we get a referral that comes in, that goes straight to our state. Within 24 hours, that family is going to be contacted by the state. They're going to explain the program to the family and what it would mean and what the services offered would be. And then that family has a choice whether they want to be a part of the program or not. And so that we've begun to understand at the state level that giving a choice to our families gives them a little bit of empowerment, and they feel like, okay, they really want to hear what I have to say rather than just give a list and do this or else. So to us, that is very, very important as part of this program. Referrals are submitted online. I didn't have the referral sheet on right now, but any of you who go to that link, this isn't a long, drawn out process to where you have to take, it's going to take you 30 minutes to fill out a referral. It'll take you less than 2 to 5 minutes. You know, it's just going to ask you the name of who's referring. It's going to ask you what the name is of the person you're referring, their contact information. When the state calls, they're going to go in with the family a little bit deeper. Well, they're going to call first the person who referred, get a little bit more information about the family. They're going to contact the family, and then there again, get a little bit more information about what the situation is going on, what problems are they seeing, how this program might fit for them and benefit them. So this isn't, the referral process isn't a long drawn out thing. Like I said, it takes less than 2 to 5 minutes to really get in there and just name and a contact number. Quick, painless. I always come. I was in ministry for over 20 years, and I used to end every sermon with any comments, questions, or snide remarks. So I've kind of kept that over the years. So, but if you have any questions, you know, I know that our time today is a little limited, but if you have any questions today, I'll do my best to try to answer. Would love to sit down with you and as providers, go into this a little bit more in depth. If you have a family in mind or a child in mind, to look and see how this program might benefit. Our goal for our providers across the state, because we see the work that you do, and you know, we couldn't do any of this without you guys, and our families need all of our services. This program is not to take something away from somebody. This is to make your job easier. This is to help. It's to be an opportunity to stand in a gap if you have one, and partner with you, and just to make sure our families get the support they need. Any comments, any questions at all that I can help with? I did put some information in the chat along with my contact information, telephone number, and email.
Hi, Randy. This is Carol from Ballot Health Strong Starts. This sounds very interesting and really good information, at least from my perspective. Certainly will utilize this and share it with my my peers as well. Do you have, and maybe I missed it in the first part because it was a little bit noisy in the background, but do you have people stationed in each county, or how does that work, like by county?
We do. We have 27 teams across the state that are serving all 95 counties in the state of Tennessee. You know, with the way the program is designed, when you're looking at the difference between maybe a care coordinator and FSS, that may be, it's SOCAP, it may be something we call TANF. Then we look at the therapist in need, and we say, okay, that may be a network county. according to the need of the family. So it would depend on which child or which agency that will be serving them. You know, my parent company is Tennessee Voices, but my program is directly from the Tennessee Department of Mental Health and Substance Abuse. So as a community engagement specialist, I have different site teams. I have Frontier Health, McNabb, Volunteer, Tennessee Voices. So I've got teams literally, I cover all of East Tennessee plus two counties in middle. And we've got a team in place that can evaluate the needs of each referral and get the resources to those families that, you know, that are needed.
That's wonderful. Do you know how many families are being assisted right now? Maybe they're in those numbers for Carter County specifically, or?
For Carter County specifically, I do not have those numbers on hand. I apologize for that.
That's okay.
We have been working on some of those others, some of those numbers as well. With each one of our teams, we'll look at it this way. Let's say we got a care coordinator and a FSS for Carter County, and that team can have 12, can handle 12 clients at one time. So, you know, a lot of us have different limits on how many caseload or other caseloads can be. But let's say, okay, Carter County's, the team directly for Carter County is full, but we still have a need. We have a referral that comes in. Well, we're going to look at the counties, our providers that touch Carter County. And so I may, for example, let's say, well, Tennessee Voices, their team is full, and they really service Carter County. But, well, now, maybe we can have a Frontier touch, and they also are like co-supporting those teams. Then we will, you know, it'll be looked at that way. If a referral comes in, this is another great thing about this program. For me, I'm all about this type of service. When that comes in, if it's after talking to the family and it seems like, maybe system of care isn't the program they need, the state just doesn't, it just doesn't end. We look at the need, evaluate that need, and it maybe it's Sliver Connections. Maybe that is the family support program. We look at the different programs around that area or in the area and say, okay, maybe SOCAT's not the program for them, but this program is. And we identify that program to the family. And then we identify that we'll reach out to that program provider, the state level does, and say, hey, here's this need. It doesn't necessarily fit system of care across Tennessee. Because really, I mean, you can tell by the information and by those statistics, this program is really set up for those kids on the top tier. They're on the ledge that we're getting ready to lose to foster care, or we're getting ready to lose to juvenile justice, or we're getting ready to lose to psychiatric placements, you know, that are having the top behavioral issues or diagnosed or just undiagnosed issues, hard time at school, hard time issues at home. Those are the kids this program is probably really designed for. We're trying to stop that tipping over the edge, that waterfall effect. And in doing that, and then when we get that, then we can step back down if I'm explaining that the right way.
No, that makes sense. Thank you. I appreciate that explanation.
Any other questions? Another part of this, like with my role too, guys, as being the community engagement specialist, I am trying to partner with as many different providers as we can. I've already done presentations and met with OmniVisions, the Realty Caregiver Program. I've also already met with the Upper Cumberland Development District that serves part of the Middle and East Tennessee counties at the same time, they carry the RCP program there. I've already reached out to Tennessee Valley, who carries that program down there. You know, program, if you look at the system of care across Tennessee and you see, okay, my program has needs there, they could use that. We could use that teamwork. And I'd love to come in, sit down with your whole team. We'll go over whether it's this presentation again, or we'll go with some more information. And we'll just look at it realistically. How might this program fit with some of our families? You know, is there coverage in the areas that we specifically need? and go from there. But I'd love to have that opportunity as well. Now, Jillian, I'll turn it back over to you. Please get my contact and reach out to me if you have any questions.
Thank you so much for sharing about your program today. If you wouldn't mind, again, just to put your information in the chat, just so everybody has it and doesn't have to scroll through all of our messages. Thank you. Thank you. We appreciate you being here. So we have lots of new folks on today. And before we jump into our committees, I wanted to ask if it's okay with my committee chairs, if each of you would share just a little bit about what the committees do or who you are. So we have 3 committees. Our first committee is substance use and mental health, a focused committee. And then our second committee is community action. And our third committee is data. And so if you all wouldn't mind to share just a little bit about your committees and kind of if you have goals for your committees or if there are certain things you're working on, if y'all would just share those, just so people that may be new today kind of have an idea of what we're doing in these breakout rooms and where they may want to plug in. So if it's okay, I'll start with Brooke, who is our chair of Committee A.
Hi, everyone. Okay, so I'm Brooke, and for Committee A, we are the Mental Health and Substance Abuse Committee. And in this committee, we are focusing on raising awareness, reducing stigma, working with the recovery community, educating on substance abuse or anything like that. Like I said, reducing stigma for mental health, reducing stigma for people who are in recovery. And it's right now we are in the process of kind of figuring out how our goals and our focus for the year. And so right now we're kind of in a planning phase of what we're going to do each month of this upcoming year. So if you want to join us, that would be great. If you work in mental health, if you work in substance use, if you have an interest in it, we would love to have your input in our planning and have you join us at our events when we have them, that kind of thing. Thank you.
Thanks, Brooke. Committee B is our Community Action and Awareness Committee, and I will ask, I think Shannon and Scott are co-chairing this committee and very new at this. So this will actually be their first meeting co-chairing this, but if one of you all or both of you all want to share kind of your vision for this committee and things that you may be working on in the future.
Scott, you got this?
Sure. I think we can handle this. One thing about with the Community Action Committee, the message of addiction and recovery is real. And for the Community Action Committee, we need to be able to carry that message to the community. There are several things that I would like to see happen, and we're working on it. I know right now February is it's Black History Month, and I would like to be able to start getting involved more with the community organizations. The message has to be out there. So somebody, the collaboration needs to be available at these different functions and at these different sites. One thing that I would also like to see in the community action is start getting involved with the school districts. I'm working on a list of the schools in Carter County. And I mean, it's one of those big, it's a big task, but I would like to be able to see at least a presentation be done in each of the schools about addiction, about recovery, because right now, you know, when young adults, when kids start to mask the pain that they're feeling with substances, they're hiding what's really going on. A lot of them, you know, bow to peer pressure. A lot of them are just doing it to fit in. Well, those are the wrong reasons. There shouldn't be a reason to turn to a substance. And I think with getting the message out, by having a presentation done in the various schools, by able to be present, you know, we have to have a presence in the community so that they know that the resources are there, that they know that they can reach out and get the help that they are looking for. And that's getting rid of that stigma. You know, stigma is a bad thing to have when you're in recovery, when you've had that addiction. You know, I'm gratefully a recovering addict and alcoholic. Okay. And my experiences, my life story can be used in a way to get that message out. And that's what I want to be able to focus on. Because, you know, just because a person picks up a substance, all right, they're doing it for that wrong reason, because they're masking the pain. They're masking what they're truly feeling. One thing that I know is upcoming is the roundtable and recovery rally at the DRC in Johnson City. I know that I'm going to make plans to make sure that we have a table there with resources available, because just because the DRC is in Johnson City, there are quite a few men and women who come from Carter County to the DRC, and they may not always know what those resources are in Carter County. So one thing that I plan on doing, and I have it on my schedule, is to be a part of that roundtable and rally. But also, like I said, I see that, you know, there are several from Elizabethton schools. I'm going to be reaching out and maybe, you know, setting up something to be able to get into the schools and get that message out to, you know, the kids that need to hear it, because a lot of times it's not just the kids that are into substances, but they may have family members, and they don't always know what to do when they see that. They might think, hey, you know what, if mom and dad can do it, or my aunt or sister, brother, you know, a lot of times that's what happens. That's how that they start down that journey. And once they start down that journey of addiction, it's hard to get back. So to be able to have the resources to get the message out, that is what is truly needed. And I think that to be able to get into the schools, that is where the message should be starting.
Hey, Scott, this is Sherry Barnett. So I am working with the schools too. As much as I want to be on your committee, I am with substance abuse and mental health. But I have started looking at some curriculums that are actually harm reduction and scientifically based, to talk to students and working with your school system. And so let's get together and talk one day about making that happen, because I also do a Narcan training with teenagers and things of that nature. So I definitely like to meet up with you and talk about that. I do have all the information about all the schools in Carter County as well, if you need that.
I appreciate that. You know, when I mentioned my recovery from alcohol and my addictions, one thing that I am not afraid to share, you know, because who knows, somebody Googles my name, you're going to see it. I spent 28 years in the Illinois Department of Corrections, and I've only been released in the last 10 months. I was released April 2nd of this year, or last year, I'm sorry, 2021. And being part of something bigger than self, to be able to get that message out there that, you know what, recovery is possible. There is hope for those that are battling addiction. Okay. One of the things that, you know, I'm really grateful for, besides my faith in God, is, Ashton Belcher gave me a chance to come out there and share with the men and women at that center. Okay. And one thing that it's needed for men and women who are currently on parole, with such as I'm on parole, to be able to see that, you know what, it is possible to come back down from that journey of addiction. It's possible to be able to have the resources in place where you don't have to mask the pain anymore, and that's the biggest thing. I love sharing my story, because I know that from the contacts that I've had and the way that I've shared my story, I've heard the feedback, to have men and women say, hey, you know what, I'm going to think about life a little bit differently. Or, call me afterwards and say, hey, you know what, I appreciated hearing that. I needed to hear that. That's what needs to be out there. There has to be something to show men and women who are in their addictions that it is possible to come away from it. There are resources. And that's the biggest thing. There's an old saying that if you want to hide something from somebody, put it in a book. People don't want to read. A lot of people in addictions are coming out of prisons and jails. They expect things to be handed to them, so they don't always look for the resources. Unless you just grab the bull by its horns and get what you need, you're not going to find out what's there. So to get that word out about resources for addiction, the healthcare that, was spoke about. And I'm sorry, I can't remember who that was with the CHIP program. When those are out there, when the information is there, the people that need it the most, they will grab it. They will grab that information. I've seen it so many times. There's so many other things that, I would like to be able to get involved with and get that word out. But that is a start. And so March, take part in the roundtable and a rally. February, I'm going to get with Jillian and see if, some of the things that she's going on, to be able to get just a table set up with information. That's all that we have to do, because those that are needing the resources, when they're sick and tired of being sick and tired, they will grab a hold of something that is positive and they will help themselves. And Sherry, I will be getting in touch with you. I sent you an email about the Narcan training for myself, but I will be getting in touch with you about the school programs.
Thank you, Scott. As y'all can tell, he is super passionate about this work, and Committee B will be a great place for you if you align with all of these amazing visions that he has for our community and the experience that he brings. I'm now going to ask Emily Brooks to quickly share a little bit about Committee C and what you all do and what your focuses are.
Hey, so I am the chair for Committee C. Committee C is assessment and data. So through the last year, we were really working on kind of defining our mission and priorities for our committee and really pinpointing those. So we created a little mission statement that highlight the priorities we're really trying to work on and get completed. So I'll just read it off to you so I don't miss anything. But Committee C's mission is to collect and organize data and provide it in an accessible way to CCC members, to assign leadership roles as needed to manage specific projects, to develop a current community resource log that's as updated as possible, and to develop a community narrative concerning the county's historical health. So a lot of that that we talked about is kind of just so we are a resource for anybody in the committee. If you're writing a grant for your organization and you quickly need to find data where it's located, the community narrative is kind of one of those things that could be really helpful with the grant. So that way it can be like just a resource for the committee as a whole. And then also venturing out and working with the health department when we are tasked with doing the community health assessment, which we're going to do every 3 years. And we're going to kind of work with along with Ballad on that. Because since they're already doing community health needs assessment, we're just going to try to not recreate the wheel and make sure we can use all the resources that are already going on in our area. So that's kind of where we're focused at right now.
Thanks, Emily and Brooke and Scott, for sharing about your committees. So now I'm going to go ahead and open the breakout rooms, and y'all are welcome to join any of these three that you want to be part of. So we'll come back together. I know our time is a little bit shorter than normal today, but I did want to make sure everybody had the opportunity to know what the breakout rooms are. So we will come back together about 1:25 and share an update with the full group.
And not to split hairs, but the Carter County Drug Prevention is also a member organization. So CCDP could be part of the Unite Us platform. And so not to get off task too much, the other three initiatives that were carried out in 2021 were an ACEs and resilience work group that worked on implementing trauma-informed systems of care throughout the region. There is a life skills, workforce development, life skills and soft skills task force. And there was a data dashboard task force, which has completed all of their work. All of the data is listed on the Strong ACC website, and all of those members are being folded into their evaluation work group. And they will be rolling out some new initiatives in the near future. And they're also right now working on creating their own logic models for these groups and maybe coming up with some new initiatives. So for very beginning, if we're a member, we can identify one or more of us in the Carter County Collaborative that will consistently attend these work group meetings and can report back to the Carter County Collaborative. And as we move forward with strategic planning as an organization, we can build those things in. I hope that answers your question.
It does, thank you.
So I didn't see any fists, or Julian, did you? We're trying to monitor everyone. Okay, well then I think we'll kind of get the ball rolling now that we've heard from the whole group to become a member organization of Strong ACC and just kind of get our foot in the door to, join our region's opportunities to kind of collectively move in the right direction together. So thank you, everybody.
Thanks, Emily. All right, Committee B, will you all share what you talked about and anything you need from the full group right now?
For Committee B, the community action, we have several events that we're going to take part in to get the message about recovery addiction and the resources available. One of them is February 18th, Glow in Dark Dodgeball, Elizabethton Park District. That'll be Friday. It's a Friday from 7 to 9. On March 12th, Think Outside the Blocks. It's a Lego event. That'll be from 2 to 4. That's a Saturday. March 14th, we're going to take part in the recovery rally at the DRC in Johnson City. That is from 9:30 to 12:30. That's a Monday. And then April 30th at Sycamore Shoals State Park from 10 to 3. We're going to take part in Kid Power. We're going to have resource information available. The events at the Parks and Rec will also be having information on the Be Safe program for the gun locks and information on that. Anything that anybody else, any other events that anybody has in mind or knows of, that we can get the message of the collaboration out. Email myself or Shannon. Shannon and I are co-chairing this committee, and just to be able to get the message out, to be able to get boots on the ground, to be able to get the Carter County Collaborative and the Drug Prevention Coalition out there, just to give some people something to think about, that, you know, addictions are real, recovery is are real, and the resources are there for those that are sick and tired of being sick and tired.
Thank you. All right, Committee A, do you want to share what y'all talked about, what you're working on, or ways we can partner?
Yes. Hold on one second. I've got this in front of my screen now. Okay, so we spent a lot of time. We had a lot of new people joining the committee today. And so we spent some time talking about our objectives, talking about planning, talking about having an in-person meeting, figuring out the best time for that for everyone. And we are also going to have an event on February 18th, 4:30 to 5:30 at the Carter County Drug Prevention Office. And this is something that I was trying to figure out how to add it to the chat box, but we may just have to send this out. But it's going to, February is teen Dating Violence Awareness and Prevention Month. And we are having a Step Ahead Tri-Cities come and do a healthy relationships and consent session with us. And hopefully that'll be a pretty good event with a good turnout. We're going to provide dinner and hopefully it'll be pretty good. And so we'll have some more planning and events and other things moving forward, but that's just our upcoming event. So if you feel like you have any resources that would be good for this and can't come, let me know. You can email them to me, and we can set them out. If you want to come, please come. You're valuable, and if you can contribute in any way, this would be an awesome opportunity. Thank you.
Can I chime in? Can I add to that just a little bit? Brooke has developed, I just want to give a shout out to Brooke, but Brooke has developed a really great tool that this committee is using. We've broken it down by month and based on categories. So ACE is mental health, substance use. So we're trying to focus on something every month. So we are planning to meet outside of this space. So if you're on a different committee and you possibly want to help out with any of these events or help plan them, we could always use extra hands and minds and brains. And if that's something that you're interested in, will you drop your email in the chat for me? Because I will be the one getting the time for that meeting, that strategic planning meeting for this committee sort of out. So if you also want to help out with that, I know that sometimes we can't meet in both committees, but there's kind of some overlap. So if the outreach committee wants to help us do, an event and a mental health awareness event in May or something, that's where the committees can kind of help together. So yeah, if you want to know more about that, you can just email me.
And just to kind of piggyback off what Kayla said, I think anything that, if there's events that are going on that have not been talked about, make sure you email myself or Shannon. That way we can have somebody there, with the information.
All right, thanks everybody. We appreciate you being here today. It's been a great meeting and a great time together. If I could have the collaborative leadership team stay on for just a second, and everybody else is free to go. So, thanks for being here.
Jillian, do you want me to stay or do you want me to go?
Yep, you can stay. So I think, Jane, do you want to try and set a time for us to get together?
Got to unmute myself. Sorry about that. I'll toss some ideas out there, and y'all let me know if it works in your schedule. Let's see, how are Fridays?